Hello, my name is Shelby and I'm going to be your nurse educator on a couple of different topics today, and mainly we're going to talk about prevention of disease, communicable diseases, and hand washing. So there are a couple of different things that we can do as healthcare employees that can help prevent the spread of diseases. One of the things that we do is hand washing. It is the most important step in preventing a communicable disease, and it is known to reduce the spread of respiratory infections, particularly by 16%. So today we're going to go over some different things that we can implement in our practice to help prevent those spreads and to help improve our hand washing, the number of times that we wash our hands, the nurses who do and don't, actually collecting the data, testing to make sure, or auditing, I should say, to make sure that our nurses and our employees are washing their hands and doing it properly is the biggest thing. Some people just run water over it, which doesn't do anything really to get rid of the germs, the bacteria and the virus. And some people are just not washing long enough, or not using the correct soap and water, or using a reusable towel. There's a lot of things that we can talk about, and a lot of different things that we can implement to help this go smoothly and be a standardized step. So I have a couple of different things here, and one of them is going to be a simple diagram of how to wash your hands. So it goes through the different steps, and we will be going through this a little bit more in depth later on in the video. And this is also great to hand out or to post up where our visitors will be washing their hands. It's one thing to talk to our healthcare workers and the employees about hand washing. Most of them already know how to properly wash their hands, but to be able to teach our visitors and family and friends of our patients to properly wash hands is going to be an important step in preventing the spread of these diseases. So this is a great tool to go over with our visitors, and it just goes step by step and how to properly wash your hands, how to get underneath your fingernails, how to make sure that we're getting the whole hand, not just the inside palms, and how long to wash our hands. And of course, the reusable, don't use reusable towels, use a single-use towel like a paper towel, and use that paper towel to shut off the faucet, because we don't want to touch what we had touched before we washed our hands. And again, I will be going over this step by step at the end of the video. Another thing that we can do, something that I've seen just being a visitor in other hospitals, is these little reminders at each hand washing station. And these are really good for employees and visitors to just glance up, and when they see it, they want to follow it. So at least I do. So just reminding them at least 20 seconds. You can sing the happy birthday song twice, or you can sing Twinkle Twinkle Little Star. And later on, when I demonstrate hand washing, we will be timing this. So just to make sure that these are correct facts, and to go over this a little bit better. But these are really good to laminate and put at the hand washing station, just as that little reminder, that little, hey, 20 seconds. One more tool that I've seen used in hospitals as a visitor and also as an employee is we can do a screening of our visitors, especially during this time where there's everything about this COVID-19, this coronavirus that's going around. Everyone has been a little bit scared, and rightfully so. We don't want this to turn into something way bigger, like what has happened with influenza. So we can start screening our visitors, and each nurse can do this on their own. And So each nurse can do this on their own, and it's just kind of a checklist for us to go over with our visitors, asking them if they've had any symptoms of a flu-like illness. So fever, cough, runny or congested nose, body aches, sore throat, chills, nausea and or vomiting, and diarrhea. So we would go through this. If they said yes to any of those, then obviously they would not be able to visit, which can be sad and it can be hard to turn people away. But it is very important that we are advocating for our patients and putting their needs first and really just protecting them from what could make them even more sick. Also, we will have them check in, get a badge so that they're identified. They would have to go through this tool every 24 hours or each day that they visit, and they would get a new badge for each day. This is just kind of a checks and balance to help us keep track of people who are visiting and keep our patients safe. We also would want to limit the visitors to one per patient, and I've seen this done. There have been a little controversy about it, but I think the main thing is that we're just limiting the exposure, which will reduce the spread. So we would have our patient, if they're able to speak, pick one person that they want to be able to visit for the whole duration of their stay. If they are unable to choose their own, then it would go to their medical power of attorney. So I also want to talk about times when we would wash our hands versus using hand sanitizer. So we want to use soap and water before and after touching patients or anything in a patient's room. Some people say, oh, I didn't actually touch the patient, so I don't need to wash my hands. But in fact, anything that the patient has touched or that is in their room could be contaminated. When your hands look or feel soiled, of course, if you get blood or sputum on your hands, you're going to want to wash them with soap and water. When you sneeze, cough, blow your nose, lick your lip your finger to turn a page, anything like that, you want to wash your hands. This kind of helps prevent the spread from you if you have it, more so than from other people. Before and after eating, this is for specific communicable diseases, but obviously it just helps us have clean hands before we're putting things into our mouth. And of course, after using the restroom. So the World Health Organization has come out with a Do the 5, and it's a reminder of the 5 things that every single person can do to help prevent the spread of, specifically, I think they're talking about coronavirus, but this can apply to all communicable diseases, especially airborne or contact. And 1 is hands. You're going to wash your hands and wash them often. 2 is elbow. You're going to use it to cough or sneeze instead of using your hands. 3 is face. Don't touch your face. Don't bring anything near your face. 4 is feet. So stay more than 3 feet apart. This is that social distancing, and that's kind of that area of the droplets. So they say 3 feet is the safe zone, or the red zone. So stay at least 3 feet away from other people. If you're talking to them or standing next to them, you want to be at least 3 feet away. And 5, feel. If you feel sick, stay home. Don't go to the store. Definitely don't go to work. Don't go out. Don't go to the gas station. Don't touch anything. They want you to just stay home. And this can be very hard for some people. Sometimes it's impossible for some people. But stay home as much as possible. Try to reduce that risk of spreading it to other people by going out to the store and touching things and touching hangers, going through clothes, touching the food as you're trying to pick it out. This is one of the biggest ways that we spread diseases out in the public. Of course, it's different for in the hospital, but we definitely want you to stay home if you feel sick. Especially don't come to work if you're going to be taking care of vulnerable patients, population, especially in the ICU, elderly, children. We want you to stay home. We don't want you to come spread it not only to our patients, but to other employees. which would put us in a shortage for care. And last but not least, before we demonstrate the hand washing, is our signage for the doors for our patients. And these are great tools that we hang on the door, or can hang on the door of any patient room who is on isolation precautions. And there is airborne and contact. There is just airborne, just droplet, droplet and contact, and special contact precautions, as well as just contact and neutropenic. So I'm not going to go through all of them. Specifically, I want to talk about the airborne and contact. This is what we are placing patients on who are a risk for being infected with coronavirus. Not risk for being infected, but are high risk of having it. So they've met the kind of criteria, and we're waiting on the test results to come back. So they're going to be on airborne and contact. So this is really neat. It goes through before you enter. So before you can come in, you need to wear a gown. You need to have your N95 mask. You need to, the patient needs to be in a negative pressure room. And you need to wear gloves and use the disposable medical equipment. As far as thermometers, we have disposable stethoscopes so that you don't bring your own in. And that just helps keep our equipment clean. And then, of course, they have before you leave this room, you need to remove your gown, remove your gloves, and make sure that you close that negative pressure door there. And then immediately after you leave the room, you're going to take your mask off. You're going to leave that on until the door is closed, and then you will wash your hands. So there is a little warning here I wanted to read. It says the use of gloves does not replace the need for cleaning your hands. Always clean your hands before entering and exiting the room. So that's just, again, urging people to wash their hands and follow these precautions. So now we're gonna wash our hands and demonstrate that. So I wanted to do this because I wanted everyone to see exactly how long 20 seconds is. I know you can't see my face, but I want you to be able to see my hands. So especially in a hospital setting, most places have a foot pedal. So I'm gonna step on this foot pedal. I'm gonna get the warm water running. I'm gonna wet my hands with warm water. And the soap is behind the camera. So I'm gonna get my soap. I have at least one squirt of soap on my hands, and we're gonna wash. Hey Siri, start my timer for 20 seconds.
Okay, 20 seconds and counting.
All right, so we're gonna wash. We're gonna go in between the hands. We're gonna go around my thumbs, making sure we get the back of my hands as well, not just the palms. That is something I see people doing. In between the fingers. They teach you to scrape up against the palm, and this helps clean out underneath your nails. And there's 20 seconds. So it's really all it is, guys. And sometimes it can feel longer. Sometimes it's like, whoa, that's 20 seconds. But it is very important that you get those 20 seconds. I'm gonna rinse thoroughly under warm water. And then I have my paper towels that I'm using. My single-use paper towels. So that's it, guys. That's all it takes. And this is one thing that can help reduce that spread of diseases. Thank you so much, and happy hand washing.